Thank you, Jerry. Good morning, everyone. I don't have a specific agenda other than to maybe give you just a general update on where we are, some resources that you can think about, how we as a congregation might want to consider expressing our faith going forward for the next 2 to 4 weeks or longer. This COVID-19 thing is real. Okay, so let's understand that. We are all at risk. I can't quantify how big that risk is yet. As of this morning, and I spent about 3 hours on the phone this morning, and I'll spend about another 3 throughout the rest of the day. Rest assured that as the healthcare leader in East Central Indiana, IU Health Ball Hospital is ready. We are as ready as we can possibly be if we do get an outbreak. We have had no confirmed cases of COVID-19 in Delaware County yet. This morning, early hours of the morning, we did have a patient come through our ED who did meet the testing criteria, which are very strict and stringent right now. So that patient will be going to our intensive care unit, will be tested, and we'll have those results back hopefully tomorrow. We all need to take prudent measures to protect ourselves, okay? COVID-19 is a disease particularly harmful to those of us with chronic medical problems and to the elderly, okay? And though it's a little tough today because in Indiana still we're doing pretty good, but the problem has been we don't have testing kits. So I don't know if there are 18 people or 18,000 people who have been exposed to the coronavirus. For example, most of you probably know what's going on in Europe, right? Bad everywhere, particularly bad in Italy, but it is now expanding rapidly in Europe. Madrid, Spain, one of the most culturally cool places in the world, though I've never been there, in one day had 1,500 new cases. One day, 1,500 new cases. So those are all things we need to do, right? So in general, avoid crowds. We have to live our lives, right? So you'll have to go to the grocery store. But in general, avoid crowds. Stay home when you can, right? Jerry talked about social distancing. The safest thing for you to do is to remain 6 feet apart from another human being. And in this congregation, that's tough to do, isn't it? Right? So I would also ask anyone who's even got a sniffle, to stay home. Okay? Stay home. Most people who get coronavirus, most healthy people, will not be very sick, might not even be as sick as the flu. It's a disease that barely affects some people, fever, cough, sometimes sore throat, sometimes shortness of breath, to mortality. Okay, that's the reality of this. I called my mom yesterday, who is 80 years old, and I said, do not come to church tomorrow. Generally speaking, if you are 55 or older and you have chronic medical problems, which would include heart disease other than high blood pressure, respiratory disease, diabetes, or your immune system doesn't function well, you absolutely should quarantine yourself in your home. If you are over 65, you should avoid all crowds. Now, you can opt in, okay, but you got to understand the risk if you choose to opt in. And those are what we're doing for our healthcare workers at the hospital also, okay? So we just have to really, really be careful. And I'm looking out there, and there's some people that I'm looking at that I love very dearly, and I know how badly we want to be a church. And Jerry and I are going to have a few more conversations about what we should do, because sometimes we have to protect ourselves from ourselves, okay? So I'm going to stop there, and I would be more than happy to entertain any specific questions any of you may have. Yes?
I was
Yeah. Maybe. Yeah, so handling stuff, right? We've got hymn books, we've got pews. You might grab the back of the pew to help yourself stand up, right? All of those things are risks. This virus likes to hang around, maybe a little bit more than some other viruses do. It loves stainless steel, okay? But it can be anywhere. So keeping your hands away from your mouth, your nose, and your eyes is a really important personal measure, right? We're going to touch public things all the time. So would we want to think about, if we're going to continue to have worship services, really doing some kind of deep Sunday morning clean? Maybe we want to do that. And then post-service have some sort of deep clean. You can't protect yourself 100%. But yeah, so what are we going to do? Are we going to open up and sing a hymn? Those are things we're going to have to decide. Great question. Yeah. So the fewer people that handle things, the better, right? So whatever you do, don't go to the smorgasbord today, right? In my cafeteria, we're so serious about this. You know, we've got a big self-serve hot bar and a big self-serve salad bar. Those are closed because we don't want more than one person to be handling those plastic tongs, even if they're healthy. Because asymptomatic people, I don't have a cough or a fever or something, can still spread this virus. Yes, John.
We got two things real quick. Number one, does alcohol, hand sanitizers work?
Yes, they work. They must be 60% alcohol or higher, but they do work. They don't replace good old-fashioned hand washing with soap and water, sing happy birthday twice, wash your hands after any contact with anything. I told Pastor Jerry I wasn't going to give him a high five or an elbow bump, which, as much as we love that in times of pandemic like this, the elbow bump is not safe. It's not safe. Yes. So
I've heard they don't protect us, but they'll protect everybody around.
The Center for Disease Control has changed their guidelines. So yes, they do help. There's a very special kind of mask. It's called an N95 mask that for healthcare workers who are going to do something with a patient who is symptomatic or a known coronavirus patient have to protect their eyes, their nose, their mouth, and this special mask. Now we're moving to, because there's a worldwide shortage of those masks, that the only time we're using that mask is in what's called a high-risk procedure where the patient is going to aerosolize their secretions. So if we have to put a breathing tube down someone's throat, you're going to have an N95 mask on. But the nurse who's going to go in and do routine care and take vital signs will no longer wear that. They'll wear a regular surgical mask. Those surgical masks are meant to protect the patient from the healthcare worker and the other people. But those are better than nothing and better than something. So for someone like you, if you have to be in a public place, having a mask probably makes sense. The problem is going to be supply again.
Well, I found a couple in my basement that I used when I was spray painting my model airplane.
Yeah.
That I stole from Dr. Foster.
Yeah, there you go. It's amazing. It used to be that pillows were the most frequently stolen item from the hospital. Now it's masks and hand sanitizer. Yeah, Karen.
I think the elephant in the room question is, should we be meeting for services?
It certainly is the elephant in the room question. And when we think about how we're going to profess our faith, I think those are things. If you get on the CDC website, it actually has a little box around faith communities. And it talks about all the things that we're talking about. It does not say today, don't have church services, but if we're canceling the NCAA tournament and a golf tournament and all those sorts of things, maybe there's a way that technology can help us as a group express our faith in a way other than to physically come in contact with each other. So Jerry and I'll probably have a few more conversations about that. But it's a great question. The conservative people would say that we all ought to be running to the hills right this instant. The liberal people would say this is all a big to-do about nothing. I'm somewhere in the middle, closer over to the people who say run for the hills. Yes?
Since the stores are sold out of like hand wipes and sprays, could you give us a website that would have a real recipe on it so we can make our
I wish I could, and I just personally would have to profess my ignorance around that. Anything that could get an alcohol content I believe this virus is also sensitive to bleach-based things, but I don't know if your Clorox wipe is adequate. I can't tell you that, but I'll see if I can, and we'll post something on our website. Yeah.
Just on that, one thing that I've been doing is calling the stores to see when they get their shipments of that stuff in, and they're very glad to tell you. And then just go that afternoon of when they get their shipments in for that stuff that they're out of constantly, and then they'll run out that day, but that's something to do.
Yeah. Good idea. Anything else? Well, thank you all. God bless you. It's a tough time for us all, and we'll get through this just fine. It's going to be a very busy, probably 4 to 6 weeks if we're thinking about how all this is gonna play out. Okay. Thanks, Jerry.
Thank
And
you, Jeff.
unfortunately, I got to run.
Yeah.